सो हम लास्ट काफ़ी सारे वीडियोस में वी वर डिस्कसिंग ऑल अबाउट ब्रेसेस, और ब्रेसेस के बारे में अगेन एक पेरेंट्स का जो कंसर्न रहता है कि हाउ लॉन्ग दिस नीड्स टू बी कंटिन्यूड, ये ब्रेसेस कब तक पहनने होता है. सो when we start the treatment of Clubfoot, we usually counsel them that this brace duration is a maintenance phase, which is an important phase and integral part of the Clubfoot management. So Clubfoot management usually is divided into two parts. One is the corrective phase, where you bring the patient to us, we apply the plaster at weekly interval, and when the foot is almost completely corrected, in the last step we do a tenotomy, and tenotomy is the last thing which we do, and a 3 weeks plaster is applied. After this the foot is completely corrected. So once the foot is completely corrected, 3 weeks after the tenotomy, we ask the parents to come to us with these braces in their hands, so that we can initiate the bracing phase or the maintenance phase. And this maintenance phase is really very important to maintain whatever correction we achieved in the initial first few months. A couple of months usually we get a good correction. So maintenance phase mein we instruct the parents that you should make the child wear these shoes all the time, especially during the first 3 months. In first 3 months, 23 hours a day this brace should be worn. After 3 months, what we need to do is we usually look at the correction. If it is very well maintained, classically it is described that foot abduction brace duration can be reduced immediately after 3 months to nights and naps. That comes to around 12 to 14 hours a day. But in our practice, what we have seen is if we drastically reduce from 23 hours a day to nights and naps or 12 to 14 hours a day, the compliance really goes down and it hits the maintenance phase. Child usually becomes not very comfortable with the shoes, and they tend to refuse or cry when they're made to wear the shoes. So it is important that we should gradually decrease the bracing period time. So we start from 23 hours a day. After 3 months, if everything goes well, we reduce the time to 20 hours a day for next 6 weeks. And every 6 weeks, we evaluate the child regarding the clinical status, whether the clubfoot is corrected clubfoot is maintained in same status or whether it is relapsing. If everything goes fine, Pirani score remains same, then we reduce the time. So from 23 hours a day to 20 hours, then gradually decrease every 2 hours every 6 weeks, so that once the child is grown up till the age of 7-8 months, when he tries to attempt stand with support or take few steps with support, at that time the brace time will actually reduce to say 12 to 14 hours, and it is at that time when the child actually needs to be out of brace to achieve his further milestone, walking independently also. So there should not be any hurry in reducing the brace wear time. This will increase the compliance to the braces and your commitment towards the maintenance phase. So any other question regarding the maintenance phase, you can contact me directly or you can text me. I'll reply as soon as possible. Thank you.